I'm Mike Huckman at the Bio Buzz Center, where it is a pleasure to welcome Dr. Eric Topol. He is the director of the Scripps Translational Science Institute. He is a rockstar cardiologist, formerly with the Cleveland Clinic. Some these days call him the dean of digital medicine as he tries to marry biotech with high tech. Dr. Topol, welcome to the Buzz Center.
Well, thanks, Mike. It's wonderful to be with you.
You're a keynoter here at this year's convention. What is the message or the messages that you want to deliver to the wide array of life sciences stakeholders who are gathered here?
Well, it's a unique time in medicine. Moore's Law, 50 years into it, is now finally coming into medicine. So we can not just digitize human beings, but we are going to democratize medicine, where patients, consumers, are going to take much more charge because they're going to be generating and seeing their own data.
What about the risk of consulting Dr. Google, though?
Well, it turns out that the smartphone doctor, whether it's an avatar and a computer, or if it's a teledoc, Doctor Connect, these are going to be a big part of the future, because a lot of routine things in medicine don't need, for diagnostic and monitoring, don't really need a physical face-to-face consultation.
So you say this and this are essentially the future of medicine?
Well, they're a big part of it, bigger than you might imagine. And you've seen already, Mike, how much effect it's had in every other aspect of our lives. And medicine is not immune to this. In fact, in many ways, it will make healthcare so much more efficient. And we need that. In fact, we are a $3 trillion expenditure, and so much of that can be cut by having efficiency in the computing digital age.
How far is this from becoming a reality?
Well, it's already a reality. We can do a cardiogram through a smartphone. We can diagnose any skin lesion or rash. We can do an eardrum exam of a child, the number one reason to go to a pediatrician. All these things are happening very quickly, monitoring any aspect of the body. Pretty soon, Mike, you'll be able to do all your own labs. So whereas before there was a home pregnancy test, there will be a home everything test through your smartphone.
What happens to the doctor, though?
The doctor becomes even more important for a different reason. Not to do the diagnostics.
I mean, you're putting yourself out of business.
It's nothing to do with me. It's actually because there's this thing called a digital world that's invading this space. And it's about time, because what's going to happen is doctors will shift more to be partners, co-pilots. They will be providing the wisdom, the experience, and the guidance based on the patient's data that they bring in. And in the not so distant future, you'll go into your doctor and you'll be saying, would you like me to see my data? Would you like me to share it with you? It's a flip of how it's right now.
Moving on, you have written and said that you believe that Angelina Jolie's very high-profile public disclosure about her genetic knowledge and the actions that she took as a result of that are seminal moments in healthcare. Why?
There isn't any question about that. It's referred to as the Angelina effect. It's a global phenomenon. Basically what happened was, when she told the world that she had gone ahead and gotten her breast cancer gene screening, the sequencing.
And ovarian as well.
And she then had both surgeries. She, as a public figure that's hard as anyone larger than that, to then get the whole public about genomics and preventive strategies to not have what her family suffered from in different types of breast and ovarian cancer. Now, what's happened since then is that the Supreme Court ruled against Myriad Genetics, and now there's all these new companies.
A company that makes diagnostics, by the way.
Yes, yeah. Breast cancer, that's where she had her breast cancer. So whereas it was $4,000, we now have companies that are offering the same sequencing for $200. And the prices will continue to plummet. And so this democratization of genomics is going to change the face of how we do a lot of things, and of course, notably, the cancer predisposition genes. BRCA is the prototype, but there's many others.
That's the abbreviation for the breast cancer gene that she has.
Exactly. So this is a changing world. When I talk about digitizing human beings, we're not just about sensors and labs, we're also talking about their genome.
And so the conversation goes full circle. Dr. Eric Topol, such a pleasure to have you here. Thanks for joining us here at the Bio Buzz Center.